Welcome back to Morning Express. It is now 25 minutes after 8 and it is on the 30th day of March 2016. On a Thursday, we have what we call Tech Central. And just in case you're an innovative Kenyan out there who would love to just let us know some of the inventions that you've come up with. We've realized that Kenyans are extremely creative, and it's not just creative on social media, because you must agree with me that when it comes to Twitter, Kenyans have a way of just making fun out of anything and all sorts of memes, but it doesn't stop there. They're also very innovative when it comes to technology, and there are quite a number of things that Kenyans have invented, and one of those, of course, that we boast about worldwide is the use of mobile money. But that's not what we're talking about here today. So in case you're a Kenyan out there and maybe you have an invention, it may not even be in use yet, but you already have the idea, you've come up with it, do let us know. We'd like to talk to you, and you can email me directly, or you can tweet. I think Twitter would be an easier way to go. Let me know that you have this idea, and we'll get in touch with you and hopefully feature it right here on Tech Central. Now, this morning I have a gentleman, a young man who's known as Brian Otieno, and Brian Otieno has invented an app known as Tambaza. Welcome, Brian. How are you doing?
I'm fine, thank you.
Let me start first of all with, are you in campus? Are you working?
I've just finished campus. I finished last year, December.
Okay.
Yeah, I'm not working
So how
yet.
old are you?
I'm 24 years old.
24?
Yeah.
Okay. So you definitely come under youth, definitely.
Yes.
Okay. And this app, Tambaza, tell me, what is Tambaza all about and how does it improve my life? Okay,
Tambaza is about linking your accounts, like it's for medical healthcare. It applies in the sector of maybe there's an emergency and I've gone to the hospital, and maybe you don't have your papers, you don't have your NHIF card or anything. So what Tambaza does, by the use of your fingerprint, all you just have to do is scan, and the application detects your profile, it detects you, brings out your profile, and then gives you payment options. So you can have NHIF, NSSF, your respective SACCO, bank accounts, or even M-Pesa. So you're provided with options. So you are the one who determines which avenue you want to pay with. If you want to pay with NHIF, you can select NHIF, and then it links your account with NHIF, then transfers money from NHIF to the hospital's account. Okay, so in short, yeah. Is it a software that will help me have my records centralized, all my medical records, or is it more to do with payment? Okay, it does more. It enters mostly about payments. So that everything's just provided on an online platform. So everything from your billing to everything from your diagnosis, everything is on an online platform. So all you just have to do is pay at a very fast and convenient rate for your medical bills. Wow. So in short, what this Tambaza does is that if I'm in hospital and I need to make a payment, I have my fingerprint scanned. Yeah. Is it only fingerprint, or can I use signatures? Oh, it's only fingerprint. It's only fingerprint. And then there's your center confirmation, which an online receipt is produced, so you can just print it out. Okay, then I'm able to select which account I want to use. Yes. Whether it is a bank account. Am I able to link it to my bank account, M-Pesa account, cooperative? Yes, any account you might pertain to. Yeah, so it just transfer, information is derived from the account you have selected, then it's sent to the bank. The bank transfers it, or maybe the institution which you have requested, the system requests it, then it transfers to the hospital. So a confirmation is sent to say that the transaction has been complete. So I made it in a way that you don't have to wait, like it doesn't take ages. Maybe you have scanned and then some redundant questions are asked, like, are you sure, confirm, So in case the money you have in your respective account is not enough, yes. So a message is sent that tells you that it's not enough. But if it's enough, the money is just deducted and you're given a message. Also, a message can be sent to your mobile phone. Okay. Yeah. I'll come to how or what gave you the idea of doing this. Yeah. But before that, one of the things I know that many people in hospitals struggle with is when it comes to payment is documentation. Yeah. Because sometimes you go and make a payment and they tell you, we need this document from NHIF, we need this card, we need all this. So does this still require that kind of documentation, or at the swipe of my fingerprint, does it have all that data stored? So I wanted to make it easier and to avoid a lot of bureaucracy. So I just wanted Kenyans to enjoy something that is fast and durable, so whereby after just swiping, everything is catered for. You just pay, and without and plus the records are in the server. because this is for the hospital. Then there's a server which has all the details, so it shows everything that has been paid for, so that you cannot have situation whereby you paid something and it's not reflected yet. Yeah.
Okay. What give you the idea of creating this app?
I just sat down and I was analyzing a lot of things. Like, I've been through situations whereby I've witnessed some people, they might go to hospital, yet they're not, like, they don't have maybe their NHIF card or something, and they're told that you must produce this. Or maybe there have been cases whereby you find someone who has gone to the hospital and maybe does not have any money on him. So it's an emergency, and some private hospitals may not accept someone without, maybe you don't have money or you're not covered. So it brings about a lot of hassle and tussle. So people jump from one hospital to another, which can be, this problem which can be eradicated easily if just someone can use their biometrics. So I wanted to create a system which is more easy and efficient.
Okay.
Yeah.
Now it sounds very technical and very elaborate, especially now when you talk about biometrics, because then I'm imagining if I'm going to use a fingerprint,
Yes.
We have some insurance companies that issue cards which have the same system, but you have to use the card, then have your fingerprint taken.
Yeah.
In terms of now the hardware,
Yeah.
how would this work? Because I'm imagining that then I should not be restricted to certain hospitals. It should be in all hospitals.
Yeah. So I wanted to make it like this. First of all, I assign people to the ground. So these people collect data from people. They collect fingerprints and everything, so that we can take it to, maybe if they are related to this particular organization, we talk to them and tell them, okay, NHIF, we have all these clients. Who are your clients? Who are medically covered? So we'd like to link the accounts for the system. So NHIF gives a go ahead. So all these people's accounts are with NHIF. So when we go to the hospital, we just tell them, we just also produce the system, we just feed it to the database of the hospital. So if anyone just comes in, can just scan, and when you choose NHIF, it already transfers. So I wanted to create a cashless or a cardless society where you just don't need all that, because maybe some people might lose their cards or anything, but you have your hands. So
okay, so this is a work in progress. It's not something that has been actualized.
yes, this is a prototype.
Okay, but you've already finished with the prototype.
Yeah.
Have you tested it?
Yeah, I've tested it, and it works. And I even presented it to some clinics, and they were like very interested in it, and they were like, when can you get this system running in the hospital? So I was very motivated to try and look for maybe more programmers to code it, so that we can help people out there.
Okay.
Yeah.
And have you worked on it alone?
Not alone. I had a friend who was a programmer, who also helped me in some places, because things like interface, I'm new into IT, but I had the interest and the passion. So he was coaching me, because he also has his other projects, and he coached me and told me, if you want to do like this, do like this. If you want to code a picture, if you want to create options, you do like this. Yeah. Yeah.
Okay, maybe let's just go through a demonstration of how it works, because you have the prototype here and you have your iPad, because I think it sounds very interesting and very creative, but maybe just run us through the actual process.
Oh, okay. So first of all, you place this is the prototype, you place your fingerprint right here, and it scans and produce results.
Okay,
Yeah.
just reverse a little bit. I don't know if we're able to get that on camera, on that camera right there.
Yeah.
Maybe you can just show us the fingerprint. Just project it to that camera right there. Yes,
Yeah.
that's the one. Slightly a bit more angle. Yes, there,
Yeah.
right there. Then yes, so that's the fingerprint.
Yeah.
And that is how the machine would look. The one
Yes.
that would read your fingerprint. Okay, so although your fingerprint seems to have a face on it, is that your fingerprint, or is that still the prototype?
It's still the prototype. So,
okay. Yeah, so go on. Click on
so when you click on it, it produces your this is your profile. So,
Okay, evidently that's not you, but
Yeah.
okay, it's just a prototype.
so there's a summary diagnosis. On this other side, there's the billing. So the total amount you owe the hospital. Then down here you have options.
Okay.
Yeah, so if you want to click on, there's NSSF, there's Equity Bank, there's NHIF, there's a circle like Quality Teachers Circle, and also M-Pesa. So if you would like to maybe pay via NHIF, you just click here, and you select that option. Or if you want like Equity, for example, just click there.
And I'm assuming that those are just examples you've given. So
Yeah.
if I have another bank which I bank with, then it
Yeah.
would be that bank.
Yeah, if maybe you're in CBA or any other bank, we'll just put in the system, because every person has their individual accounts in different banks.
Right.
So we just choose the one which you like is convenient to you. When then we'll update it in your profile once we set up the system for you.
Okay.
Yeah.
Yeah, carry on.
So there's also M-Pesa.
If I want to pay via M-Pesa.
Yeah.
Okay.
So maybe if we choose like Equity Bank, you just select there, then you click just on pay, then it processes, a confirmation is sent, then a receipt.
What does it say on the confirmation? Your request is granted, or?
Yeah. It
On-
just says the amount of money, it's confirming the amount of money which has been transferred from your account to the hospital's account, then a receipt is provided.
Okay, wow. So now you'd have to integrate this system with the hospital
Yeah.
so that it appears on their records that you've actually paid.
Yeah, so that even in the servers, there's like this patient has paid everything, and they're given plus it confirms everything.
Okay.
Yeah.
Now the other side of it, obviously, I don't know if you've looked at, is it's subject to abuse.
Yeah.
Because obviously, if somebody, for instance, especially in a case of emergency, somebody might not be conscious. One could just, punch on that. Or how would that security be taken care of?
Okay, for a situation whereby someone is unconscious, we have created an option where there's a next of kin. Let's say if you like, if there's an emergency and maybe I'm not be in a situation whereby I can pay, I can say that maybe if you're my father or my brother or anything, I can say this person can do it for me. So we have also want to create that platform so that we cannot be like someone might say that I was unconscious, I'm not fully aware of this payment being made. So to avoid abuse cases.
Okay.
Yeah.
Now, given that you've already come up with a prototype, what's the procedure now to have it integrated into the various institutions? Because here we're talking, I mean, this is huge.
Yeah.
We're talking about hospitals in all over the country.
Yeah.
We're talking about all sorts of banks.
Yeah.
We're talking about other payment platforms like mobile money.
Yeah.
What's the next procedure now that you have the prototype?
So after the prototype, what I want to do is a pilot test. So all I just need is, I have already the programmers, but I lack the capital because programmers out here are very expensive. So I just want, if in case I get an angel investor, I'd like to attend the capital so that we can pay the programmers. Already I have clients, I have like 4 hospitals who would like it. Then we take it to the hospital, we create the server for them, then we go we share, the hospital can give us their patients, the patient's contacts. Then we can, with the authorization of the hospital, we can call the patients. Then we have this and this. We'd like to help you. Then after that, we may interview the patients. Then we may collect their data. Then we might then contact the banks or any financial institution they're affiliated to. So we create their profile. So anytime they access these respective hospitals, they're able to make the payment using biometrics.
Okay.
Yeah.
And have you done like a cost analysis? What is the financial implication of this whole exercise? It sounds huge.
Yeah, that's why I was saying it really needs an angel investor, because we need the cooperation of banks. We need insurance companies on board. We need hospitals on board. So that's why I really require an angel investor, because it requires a lot of funding.
Okay.
Yeah.
Now, we're currently having a seminar that's going on at the KICC, and they're looking at the curriculum and the education system.
Yeah.
By virtue of your age, I would assume that you probably went through the 844 system.
Yes.
And one of the things that has been a challenge is having innovators like yourself. There are people who are going into campus expecting to be employed, but evidently you've thought out of the box. Let's start with your background of education.
Yeah.
What's your background of education?
Well,
Apart from the 844.
My background of education. Well, apart from 844, I just read a lot of novels. I watch a lot of documentaries. It helps me to be creative so that I can able to think outside the box. Plus, also, I can attribute my innovativeness from my childhood history. I was in Guru Nanak Primary School, and what I attained from that school was you're given clay and you're told maybe create something. So there was this Asian kid who created a colosseum with just clay. So I was when I was young, I was whoa, that's big. So I wanted to be creative and imaginative. So when I'm provided with something, I can make the best out of it.
What's your background of education in campus? What are you studying?
Oh, in campus, I studied linguistics, media, and communication.
Again, it's completely out of the box. Linguistics is nowhere close to this.
Yeah.
So what